Hello everyone, we'll discuss here ethics in pediatrics. We'll cover high-yield points in ethics and what is really important for all pediatricians to know. Negligence and malpractice. Our goal as pediatricians is not to be entitled at any time throughout our career as negligent or go through any case of malpractice. Pediatricians are expected to adhere to the highest level of professional conduct. If their behavior is found to be substandard or a patient is harmed, as a result, the pediatrician can be sued for malpractice. Pediatricians are sued most commonly for errors in diagnosis related to several conditions, for example, meningitis. If you suspect meningitis, you have to treat. Don't delay the treatment. Don't be reluctant to perform LP or lumbar puncture. Very important to know that absence of Kernicks or Brodzinski sign or meningeal signs doesn't rule out meningitis. Very important to be highly suspicious so you don't miss this critical diagnosis. Pneumonia also can be easily missed. If you suspect a case of pneumonia based on history and physical examination, you have to treat. You do not need a chest x-ray to make the diagnosis of pneumonia. Also, pneumonia can present with chest pain, can present with abdominal pain. Very important to be familiar with all atypical presentation of cases of pneumonia. A 5-year-old boy was diagnosed initially with minimally changed disease. Based on history, physical exam, and lab results, he continued to have high protein in urine despite the appropriate treatment for nephrotic syndrome. You decided to refer the child to a pediatric nephrologist for renal biopsy and further management. What is the ethical principle of referring a child to an expert in the field? Beneficence, non-maleficence, veracity, fidelity, sincerity. The correct answer is beneficence. The meaning of beneficence, the quality or state of doing or producing good, which is the ethical principle of referring a child to an expert in the field. Beneficence is the primary ethical principle in pediatrics. Beneficence is doing good for others and acting in patients' best interest. This includes the consideration of treatment efficacy and the potential to lessen disability or complications. For example, referring a child to an expert in the field in order to provide the best treatment available.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.